So, welcome to the Floki podcast. My name's Nick Bramley, and I'm delighted to be your podcast host. And with me today is our podcast guest, CEO of Floki Health, Fenwick Smith. Now, we're going to explore driving NHS performance and cost saving through innovation, but we've rather mischievously entitled this podcast, Where's My Bladder Scanner? So, without further ado, and to understand what this is all about, I'd like to introduce you to Fen Smith. Fen, welcome to the podcast.
Thank you very much, Nick. How are you doing? Are you well?
I'm very good. I'm very good. And I'm delighted to be on this session with you because I'm going to make you blush now, Fen. You're probably one of the most authentic and passionate people I've ever met in business. And I've had the pleasure of working with you for a while and knowing you for a number of years. And this episode's about exploring that passion and innovation and drive towards helping the NHS to improve performance and drive some cost saving. And it all came about through a personal health scare. So we're going to explore quite a few things over the next sort of 40 minutes or so. But to set the scene, I guess, we'd like to explain for the listeners and the viewers what Floki is and what Floki does offer the NHS in a bit of a nutshell.
Yeah, thanks, Nick. And you did make me blush. So Floki Health is a business that I started some 7 years ago now, from a personal experience when I was a patient, not a provider to the NHS. I had a medical condition where I needed a back operation, and it took 7 months walking around on crutches to the time that I got surgery. And it wasn't a great place. It was a particularly dark period in my life, I would say, where living from day to day, just trying to get through the immense pain that I was in. And I thought there must be lots and lots of people that are in this situation. And I thought I've had 20 years of industry at the time, and I've had a lifetime of looking at processes and examining them in a logical process. The way my mind works is quite peculiar at times, but and I did a manufacturing degree in terms of how to make things more efficient. And I just thought, yep, there's definitely some opportunity here. And we looked at how we could help. And we started the business 2017. And here we are, some 7 years on. And we've built essentially a medical device tracking platform that helps to give data.
Okay, well, we'll explore that a bit more, but let's explain the name Floki. Now, I'm a big fan of this TV series Vikings, and Floki was a key character in that. If anyone watches it, is that connected? Where does the name Floki come from?
It is actually, yeah. It was around about 2017, or a little bit before that. I thought we were looking for names, and I was looking for things around flow and the key to flow. And obviously the characters, he's a little bit dark, I would say. He's a bit avant-garde in the way that he thinks. And I drew some similarities to that in terms of, people think when you're trying to do something different that you're a little bit cranky. And that you don't think the same way as other people. And when you're not the norm, people sometimes get challenged. But yeah, and he also built ships and discovered new land. So I thought, yeah, there's some alignment there.
That's okay. I love that. I love the connection because I'm a big fan of the series, and
Me too.
I can see the similarities, the sort of slightly off the wall thinking and slightly avant-garde sort of approach to things. But you couldn't accuse you of not getting things done. So that's really essential.
Yeah.
So touching on what you briefly mentioned there, it's about kind of using data and creating a platform for information. Now, essentially, what you're looking at is asset tracking and asset management in real time, aren't you? So things that go missing. We've called this, where's my bladder scanner, just as a mischievous title for the podcast. there's a lot of equipment and a lot of assets in the NHS. Is this a real problem? These things that go missing, you can't find them. What's the impact of that? How does that work?
Yeah. So how it all started, and I always bring it back to what's the need, and who has that need, and what value can it bring. Um, I was doing a set of workshops for the NHS to try and help them to create some visibility and some vision around what opportunities there were. And I was walking the floor with he was head of clinical engineering, and he introduced me to Amanda and combined ambulatory care, and she said, "Hello, I'm Amanda," and I said, "Hello, I'm Fennec," and then the guy walked off, and I thought, she's not looking right. And I said, "Are you okay?" She went, "No, not really." I said, "What's the matter?" She said, "I can't find my bladder scanner. I've sent 3 people to look for it. I've had I've had so much time spent." And I thought, 3 people. She said, "They've been looking for it all afternoon." I said, "Well, what I'd like you to do, I can't help you now, but what I'd like you to do is to come to the workshop. And I think there are some things that we can do, but I need to hear more." And kind of the weight relieved off her face. And that was the kind of epiphany moment that we knew we had something. I mean, the way in terms of data, um, my history throughout my professional career really has been looking at manufacturing data and understanding the value that that can bring. And I knew if we could create some live data on where they are, the problem would resolve itself.
So there was a real time moment where you realized the amount of waste, effort, time, energy, and stress that was putting on people, and that was just for one piece of equipment. We call them assets.
Mhm.
In one ward, in one hospital, within one trust, and
Yeah.
there must have been some light bulbs there going, well, hang on a minute, let's roll this out across the NHS. I mean, are we talking about any particular assets, or is it ward centric or department specific? What was your initial thoughts about the scale of potential that Floki could potentially help with?
So there's 236 trusts. Um, that multiplication itself, there's small and big hospitals and huge hospitals in and amongst that. Um, so the quantum is bigger than you can probably imagine.
Mm.
Um, and the timing aspect of how long people were looking for things was the real driver. If you can provide a simple solution, and the reason we invited Amanda to the meeting was because we were very centric around fully understanding the problem, and before you go ahead and try and fix it, we did some calculations. We looked at the frequency of occurrence, we looked at how long it took, we looked at the opportunity throughout the whole NHS, and it was inordinate. And that's just one item.
I remember in the early days working with you where you were saying that we used to use a stat, didn't we, that an average nurse practitioner will spend over an hour per shift, every shift, looking for stuff. And you
Yeah,
think
per
to
ward.
yourself, well, that's not then patient facing. It's not doing the job that they want to do
Yeah,
and enjoy doing, which is, giving healthcare to people. And yet you multiply that hour times how many staff and nursing practitioners in the NHS. And like you
yeah,
say, the figures are almost too staggering to
yeah,
compute.
yeah.
So you're obviously onto something early in terms of an idea.
Yeah.
How did you secure your first projects and who were the early adopters of this? Because it's something new, it's something different. And at that time, with all due respect to the NHS, it's changed since COVID, but they weren't known for this early adoption kind of approach. So how did it work in the first instance with projects, adopters and supporters?
Um, so we set a vision. First of all, we went into our local trust. suggested the opportunity that there was after running these workshops. I was actually then doing a financial pitch to them, and they said there's actually there's a committee next door going on, and I'd like you to go and speak to them. So in true fashion, I down my presentation and shifted rooms, and there was 17 of them, and I listened to what they had to say, and then I suggested that understanding data and in real time allows you to unearth problems and opportunities. And if you're focused around that, then you can direct the solution to the problem that you have. And that's a key point, is you don't need to put a huge infrastructure or a huge encumbrance and specify it right at the very beginning and then have a 2-year cycle. You can look at one item, you can look at it and figure out the best method of tracking it and then solve that problem. And that's the mindset that we should challenge.
And I think the key there is, what's your biggest problem? What's your most recurring problem? What's the one that's giving you the most sort of stress and, time consuming? And it might be a repetition of losing bladder scanners. It might be losing, monitors for something or whatever it might be. So, what I really like about how you approached it is, you haven't gone in there with a big corporate solution based around a huge investment in IT infrastructure. You've just looked at it and said, what are the problems that we can solve around kind of managing data to track and manage assets? So let's explore that journey a little bit, because I guess at some point we're going to look back on those early adopters and say, you were the first to give Floki Health the chance to demonstrate this kind of case studies. It's a very different kind of proposition now in 2024 to what it was in 2017. Do you want to talk us through the evolution bit a little bit, from what you started doing to what it currently looks like now, and where innovation sits in there?
Yeah, it's funny you should say that, Nick. I actually reviewed some of our very first roadmaps a couple of weeks ago. In that very first meeting that I had, we put a technology roadmap together in terms of discovering what the different technologies to harvest that real-time or near real-time data. And looking back now, we've actually accomplished all 8 different technologies. And we have about 11 different methods of pulling data into the platform, from really expensive, in terms of at one end, and zero cost at the other end. And some of those are working practices. Some of them are RFID barcodes, QR codes, mobile apps, and it's not putting the technology at the core of it, but having on one eye looking at the progress of where those technologies unlock the data. And I have a matrices in my mind that says, what's the acquisition cost of that data, how frequently, and what do you want to do with it? And that little cycle defines the business case for each of the individual items.
I think one of the things that impressed me in the early days of working with you was it's not necessarily just about finding the assets. It's about finding that the assets, when you do get hold of them, are in need of maintenance, or they're not working or whatever. So it wasn't just let's find them, it was let's track their maintenance cycles and maintenance schedules. So that was an early added value over and above what I originally thought the intent was. Let's just find my bladder scanner, but actually let's make sure it's maintained twice a year or wherever it might be within the manufacturer's requirements, so that when we do find it, we can use it on the ward. That was the first innovation I saw. Innovations really, you've never stood still, have you, since 2017?
No, no, not at all. I mean, we've done an AI module just recently, looking at levels. which helps to connect the people who move assets with the data in terms of what the deficit of those assets are at different locations. And you know, when I look back at the very start of it, I didn't know a lot about the technology side of things, but you know, I've spent a significant amount of time looking at it and figuring out how we can deploy it and understanding how we can bootstrap it, and then how do we bring that value to the client. And that's the key is, you know, we haven't gone and financed it and created the encumbrance of a PLC, which I've been involved with before, where you have sales targets to meet, and if you fail those, people lose their jobs. We've taken it on an organic growth, but iteratively we've created new technologies that talk to different use cases.
But each time you're also getting feedback from your NHS trust customers, clients, call them what you will, in terms of, oh, if it did this, or if it had that, or if you could think of a version 2 that would give me, whether it's either reporting or dashboard changes, or how the technology pings.
Yep.
And you've evolved that as well, haven't you? Is that always part of your cycle of evolution in terms of really getting close to the problem?
Nick, it's the epiphany moment, really, when if you can stand really close to the user, you hear the direct feedback. And we have a weekly heartbeat with our clients where we listen to the challenges that they're having. And on a 2-week cycle, we deliver technology or improvements or matrices or measures or new dashboards around how to solve those problems. And the key is the harmony between the NHS understand that there's value there, and they're able to resource that. And I think it needs a product owner. It needs someone who cares about the actual improvement cycle and who is accountable for it. And then there's a stakeholder above those that says, you know, and if they are really good, they look at it and say, what do the users need? And how you navigate that is, you can't preempt it, you can't predict it, you can budget for it. But I have a saying that, you know, innovation's like a wet bar of soap. You know, in terms of finance, the tighter that you squeeze it, the quicker it pops out. And it's about having the right balance, and it's the diametrically opposed innovation is control, you know. And the more you try and control it and preempt it and specify it at the very beginning, the journey itself helps you to understand the applicable nature of what you're developing. And it requires pivots, it requires failure. You know, you got to fail fast. And that's why on this cycle of weekly heartbeats, that gives you the real cadence to focus.
It gives you the front end live information, doesn't it, on a weekly basis as to, you know, what the real time situation now is, because circumstances change. This is not about one asset type. It's not even about one ward or one hospital, because again, in the early days, you started thinking about assets out in the community, didn't you? And how to track those, because a lot of assets go out into the community for various reasons and maybe never see the light of day back into the trust because of all sorts of factors. Again, what was the game changer there then, in terms of what was the reason for thinking about that?
So we spoke to the biggest trust in the UK, which is GG&C, Glasgow, and they have such a wide geographical area. And we were listening. We'd done one hospital, Glasgow Royal Infirmary. We'd then done another one, the Royal Alexandra Hospital, and we were tracking T34 pumps. And what we found was that when they were going out to the health, nobody knew where they were once they left. So we listened to them, and the team pulled together a simple geofence scenario. So we had 8 different community centres, which we ran a proof of concept trial. They had no money to do the trial.
Yeah.
So we collectively, well, I pulled a bid together, an Innovate UK bid, and we were successful. We won £50,000,
Yeah.
and we put that holistically towards solving this problem. A paper's coming out very shortly on it, actually. And what happened was we were able to scan a QR code with a standard bit of, anybody's smartphone, and deposit the information about what that asset was and where it was. And if it sat within a GP centre or a health centre, then it would be allocated to the centre. If it was outside and issued to a patient's home, it was on that geographical location. So there's lots of different opportunities that actually collectively, with some creative inspiration, and that's not just Floki, that is the desire and the passion of the people who have the problem. That relates the energy that they have lifted when you solve the problem is payment in itself. It's you're helping people, at the
But
core
the
of it.
energy of the person with the problem, I presume, has a direct correlation to the success of the project as well, because you need
Yeah,
champions, you need
yeah.
people who are going to fight to
Early
get it
adopters.
done.
Yep.
Yeah, okay. I want to talk about blockers later, but I want to talk about successes as well.
Yeah.
There's loads of development in functionality. You've talked about AI as a recent innovation, for example. Is there something perhaps you're the most proud of between 2017 and 2024 so far, perhaps in terms of either functionality or what you've delivered to the NHS? What makes you smile on a morning and think, yeah, we did that?
Do you know, Nick? I think it's about iterative improvements. There isn't a moment that you go, oh, it's brilliant. I mean, there are, but it's not that really. It's when you look back and think, where did we start, that you see the distance that you've covered. It's like last year I started swimming. I mean, I've always swam breaststroke, and I thought, right, I'm gonna get good, and I'm going to learn front crawl. And over the course of well, it's over a year now. By then, in May, we started just doing one front and one breaststroke, and one front and one breaststroke. And we, well, stretched it out, and, it took me, a lot longer than I do it now. And I set myself a goal. I said, by an anniversary day, which is the 2nd of August, I wanted to hit under 40 minutes. And on the 2nd of August, I did it. And
Yeah.
I saw my times. I actually did a LinkedIn plot. I saw my times coming down. And it's about, it's that fine refinement. It's the, working on technique. It's working on diet. It's working on sleep. It's understanding those marginal gains that give you that improvement. And now, I'm down sub 38. So it doesn't stop, but it requires consistency. It requires, when it's hard and when it's cold, when you don't want to do it and you've been up late, and you've just got to make it part of your cycle. And I think that balance of not being so hell-bent on today's results, but understand the journey that you're on, helps you to navigate those challenges of finance. And that is the mentality that helps you to pass those challenging times.
Well, I think if you're working into the NHS, you're doing it at the moment on a trust by trust basis, a business case basis, a a case study basis and getting, lots of traction, lots of interest. I think what you got to do there is look and say each trust is different. What are the marginal gains? Would it be that we've got a 10% saving on lost equipment, or is it that we're spending half an hour looking instead of an hour, or is it we're not looking at all anymore because we're using the tracking mechanisms? And it's all little things that add up to something quite significant, isn't it? But you need that champion. Those
Yeah.
business cases and case studies that you use, I know you use them a lot. You call them use cases, which is a term I've not been used to before. How have they helped you to demonstrate impact to trusts that are yet to be on board?
I think if you ask three people, what is it that's important to them, they'll give you three different answers. Someone from finance, someone from clinical engineering, someone from a clinical background, they'll all give you different um, visions of success. And I think what you've got to do is you've got to glue those together at the early days.
Mm.
And you've got to say, I have a thought. Let's hear where you think the opportunities are. And we vote on it. We vote on the things that have high frequency of occurrence and high value. And we step back and say, we'll solve the problems, and then they become owners of that solution. And that's a powerful tool to help the psyche glue together. So
That
the use cases are really, they're focused because they are the use cases that are agreed upon.
mm.
And you can see progress. And one of the challenges I always have, Nick, is at the start of the project, people want to specify down to the nth degree. I had an old boss who used to say it's analysis to paralysis. Um, and the challenge that I say, start early, put some guide rails around it, and then have a high frequency of review,
Mm.
but a review around the roadblockers, and you collectively you can see where those improvements are. And it's a psyche to involve innovation. And it's not just innovation in Floki, it's innovation in the mindset and the actions of healthcare professionals.
Okay. It's about not building a straight line as well, isn't it? Because that straight line doesn't go. Your solutions and the NHS do not work from A to B in a straight line. They go from A to B on all sorts of wonky mountain railways, don't they? That are probably, at some points unstable, but they'll get there in the end. So we got to be prepared for that journey, haven't we, I guess?
I was thinking then like of sailing, when you're sailing and you're pointing at a waypoint and you're heading, and let's say you're tacking and it blows a gust and it blows you off slightly and you readjust. Sometimes you think, right, I'm actually heading towards the wrong buoy. We're turning like 45 degrees, and it's constantly about understanding what the energy and the direction of those challenges are and how you solve them, and not get caught up in the minutiae, but do the simple things right. Pay suppliers on time, set some guidelines around how to make it simple, provide the resource um, that small organizations need to have that cadence of communication. They're the
And what
simple things.
and what I like about that, you treat each NHS trust department or function as an independent small organization, don't you? Which means that you're getting that buy-in, that local
Yeah.
kind of support, that championing on a localized level, because the NHS is such a beast of an organization. It'd be impossible to enter that at a corporate level. It's just so difficult to navigate for small business, isn't it?
It's impossible. They're all busy professionals. Um, Generally, they want to do a good job. Well, they do want to do a good job, not generally, but generally, risk versus safeness is a challenge when you try to change, moving, if you've always done what you've always, if you always do what you've always done, you always get what you've always had.
Yeah.
And that's, you've got to do something different. Floki created boats,
Yeah.
and he pointed in one direction and set a raven off and followed the raven. That's what happened, That was the story behind it.
Okay. Well, looking at the support you've had and how it works in terms of external partners, I know people like Innovate UK, you've mentioned already, a number of universities and the likes. How important your network that you've built in helping Floki to continue what your journey is, and what have been some of the high points of those external relationships in your business development as Floki Health?
I think they're all stimuli and inputs. They help to um, help you as a leader to say, is the direction that we're going right? Is this something that's of need? Because generally, well, it's difficult to align a grant with the business need, but I think when you win those things, generally they are there's a lot of examination around why you're trying to do, and it's almost like a due diligence around your cortex thinking,
Mm,
and you know. But what I would say is, from technology partners like the CPI, we've worked with the Hartree Centre recently. It provided 12 weeks of fantastic support, and it was funny when we talked about Cadence, the brilliant PhD um, data scientist said to me, said, do you just want to do the weekly touch on heartbeat? And I went, no. Said, we're coming in. We're coming in and we're going to spend 2 hours a week. And that iterative process led to far greater distance traveled. Um, and I think at the end of it, I asked him what was the thing that he learned most about it. And he said that interaction
mm,
um, helped. It made my job simple because I was working on weekly tasks.
yeah.
And what I got out of it was something that was really usable. And at the end of the 12 weeks, and we did a presentation to the chief information officer, and he said it was really good. And for it to do in 12 weeks. And there's lots and lots of examples of
Mm.
funds that are out there. And without it, in those dry spots, it's a question of resistance over persistence.
It's allowing you to keep going, isn't it, with it
Yeah,
with this
yeah,
passion and energy.
yeah.
Quick question, and it's not really relevant to Floki perhaps, but it's relevant to innovation. Do you think that all that COVID brought to the NHS with regard to the Nightingale hospitals and that kind of thing, did that change thinking, or was that temporary?
Really difficult to say. I think the first flux of energy and effort and money that went in to build these centers was amazing. That was truly and utterly warlike in terms of its effort, in terms of a country coming together,
Mm,
focused on not being um, broken by the big wheel of large corporations,
yeah.
trying to get stuff done. I was going to say something else there, but I think that the challenge is to keep that energy and that psychology together. It's a challenge because what has happened is that the NHS is stretched further and further every year. They're
Mm,
expected to make savings with little to no money.
mm,
And that's psychology is, you've got to be able to invest. And that's not from Floki's point of view. To make improvements, you've got to get good people. You've got
mm,
to get people with the knowledge, with the passion, and you got to facilitate those people who have the knowledge, who are already within the organization, and you've got to lift their load and create some time. And if that simple acorn is planted, then what will happen is people within the organization will take ownership of the data and then use it to create value.
There's
Simple as
some hellishly good people in the NHS, isn't there, still, who are dead keen to do things on
passionate
the
people.
local level, passionate,
Yeah,
energized. I guess the key is,
yeah.
working with them to release that energy and that passion. So, on that basis, obviously, we talk about cost saving and innovation and improving efficiencies as part of the sort of title of this podcast. You can demonstrate a clear return on investment. You can
Yeah.
demonstrate efficiency, time saving, asset management, reduction of loss, but there must be still a few frustrations in getting that traction across within some trusts. So, what do you reckon are the potential blockers? And is it something to do with perception versus reality?
Um, I think, Nick, the way that it's funded, there's two things that are fundamentally flawed, if I can be as bold. Um, Having directorates trying to solve their own problems is a challenge. It needs some grown-up thinking, collective, collaborative thinking at trust level. Budgets need to be set, and experienced program managers need to be able to see the value and facilitate communication, funding, and that resource level in the interaction between innovators and the NHS users. And when that happens, that's the first real challenge. And the second is just frameworks. Frameworks are an encumbrance that purport to reduce risk but increase cost. And the delay, now, in my simple mind, the challenge that I have is when you do one or the other, you either add cost or you add value.
Mm.
And when you have frameworks, they add cost, they try to reduce risk, but they only do that by specification. And as we've discussed, specification should be a guideline. It shouldn't be, we want X number in here.
And the thing with specification is, at the point of specification for asset tracking, asset management, they probably don't even know what they're looking to specify. So it's an impossible
Yeah.
thing to put on a framework. That's why the local champions and the local sort of case studies are probably the way forward. But
Yeah.
if I was an NHS Trust senior director responsible for any aspect of this, finance, assets, clinical, whatever, what would be the process of me even considering how you could present a potential solution to me? How does it work? I've got an idea. I've seen something. What do I do? How do I get in touch? What do I do with you and Floki?
So the first thing is to really try and understand what problem they believe that they have.
Hmm.
And then this is something that they can do internally, because the more that they understand before they interact with third parties, you know, to some extent, the better equipped they are to have that open mindset. But so the engagement point is to know you've got a problem, to know you've got some money to fix it, and that you've got some resource and engagement of the people who need to be interacting. When you've got that little recipe there, the simplest interaction point is to run some workshops, and that's to confirm or deny that you have the problem.
Yeah.
To vote on the direction of challenge, to create a hypothesis and a vision, and then in small bite sizes eat that elephant, create the framework of how that's to be working, create the guidelines on plus and minus negative on funding, and then support it. You
Yeah.
can't do it by beating people up and saying we wanted to do it for nothing, not the interaction from the NHS. Internally, they
Yeah.
need support. This is where the quantum of shift in mindset, it's not just about the medical delivery that creates the medical delivery. It's those support functions. It's the interaction and the efficiency of knowing where things are, of the priority of things, of knowing if they're compliant or not, or if you need, a porter in A&E to take a pump from the ambulatory care to orthopedics. It's having that and creating that vision and squashing it into a real simple work to list. That's where you will make significant, progressive, incremental challenges in the same way as you swim starts at 50 minutes and ends at 38.
Excellent.
That's how you
I don't think it ends at 38 for you, Fen, but we'll
no.
see. We'll see.
No.
Yeah, I might race you one day because I've been on an active swimming for about 18 months, and I'm quite proud of my times. But we'll move on from that. No one cares about that. A question about the NHS structure. It seems to me, to the outside world, that it's a constantly shifting restructure, trust responsibilities, mergers, acquisitions, budget responsibilities, all
Yeah,
that sort of landscape changing. Is that bureaucratic challenge one of your biggest headaches?
it's certainly a challenge. I think the structure of how the NHS are starting to work with the appointment of chief information officers, um, and giving them either direct access to the board as in a seat or report directly to the chief executive. They're the little instrumental things that make a shift. Bureaucracy will always happen. Decision by committee will always happen. It takes a strong leader, Nick, to say we're going to take a risk.
Mm.
We're going to point west and throw a raven up and let's go. And it takes that energy, and it takes sometimes though, it ultimately comes down to people,
Yeah.
right? It's finding the right people who have the problem, who have a passion, and can pathfind. They can circumnavigate funding. They can circumnavigate culture. They can circumnavigate the technology that may or may not work or may
Mm.
need repivoting. There, it's the people. And that's the first thing I look for when I go into that organization. What are the people like? Is there anyone there who will give us um, a good percentage of what we need?
Yeah. Will they get things done? That's what you
Yeah.
want, don't you? You want somebody on
Yeah.
the other side of the table who's got the same energy and passion as you. Okay. Couple of quick questions to finish with. You've obviously got those champions. You obviously got those trusts on board. You've got people who are absolutely already benefiting significantly from Floki. What's the ambition for the rest of the year, into next year, perhaps? And how are things looking on the sort of growth front for Floki and your sort of trust relationships?
Yeah, well, we're developing the team. I think we've gone through an iterative cycle of technology, of customer validation. And I think there's going to be a number of different ways that the business grows. I think it grows um, by applying for frameworks, by reaching out to third, well, cousins twice removed trusts of those that we work with. I think ICSs are probably going to play a bigger instrumental role in terms of sharing good practice. But sometimes it's still like alignment of stars, celestial stars.
Mm.
There's no getting around it. I think that we've grown in the last 2 years significantly. If I look back, I counted, there've been 25 people that have worked on the project from the very start.
Mm,
And there's currently there's 6 core people, I would say, but when we need it, when we need someone, we'll bring them in.
mm,
And that will be for the duration, or it'll be for the duration of what, the technology that we need, or the expertise and skill. And I think that's the if I'd have started at the beginning with a fund and gone and procured those people, I've seen that, I've lived that life, and you're fighting that the highs and lows. So we're on a stable footing. We've got a good bank account. We've got people in the right places. We've got highly motivated people who want to do it for the right reasons,
yeah,
and a relatively low cost base. So from a sales point of view, it's always nice to get new sales.
yeah.
There's a reoccurring model that we have, and I wouldn't say I'm a big risk taker, but I'm passionate about solving it. So the opportunity's there, though, for
Well,
sure.
I will make you blush again. I think a lot of that in terms of people wanting to work hard and put the energy in and focus on, look, it comes down to your leadership and your leadership style, Fen. So, take that as a
Yeah.
genuine pat on the back from a guy who's worked with you and had the pleasure of doing so for a
Thank
couple of
you.
years. I've enjoyed every minute of what our interactions and working. I'm sure your team or your core six do that on a daily basis. So blush away, Fen.
Thank you.
I'm going to finish with one final question, really. Um, in the darker days of COVID, for everyone, for the trust, for the business, no decisions were being made by NHS on anything to do with Floki. It was just to do with getting through that day, that hour, that week, wasn't it? At the time, you were exploring the technology with outside organization. I think we talked once about a dental practice company who had vans of stuff
Yeah.
going out. Have you
Yeah.
got any ambitions at this stage to take the Floki technology, this asset tracking excellence outside of
Yeah.
the NHS, or is the NHS your focus for now?
Do you know, it's my passion, Nick? I think I've been involved in industries that I wasn't particularly passionate about, but I did the best job that I could. I think when you have a set of skills, and I'm not Liam Neeson, by the way, when you have a particular set of skills that you've honed over a number of years, and you're doing some good, it's immensely rewarding. Um, and I I love giving my time to good causes,
Mm,
and my energy. I run 2 football teams. I swim, I surf. Um, I have very little free time,
yeah,
but um, I think the greatest reward is when you give. That's knowledge, it's
yeah.
time, it's direction, um, and to want the best for other people, and that's what motivates me, really, Nick.
Okay.
Um,
I think
money
I think we
comes
should
and goes.
I think we should finish the podcast on that high note there, because that is, in essence, Fen Smith, the Floki Health CEO, and the DNA of your business. I'd like to thank you for sharing that passion, that energy, what you're trying to achieve. I think, we haven't talked a lot about asset tracking because that's the end game. In my view, is always, what's the output, not what the input. The input sort of doesn't matter as long as it delivers on the output. So
Yeah,
it sort of doesn't matter that it's asset tracking. It
yeah,
sort of doesn't matter that it's done through kind of barcodes and all sorts of AI technology. What matters is driving NHS performance and cost saving through innovation. And on that note, I'm just going to share the final screen, which is our contact details for people who would like to get in touch. They won't want to get in touch with me. I'm just the podcast host, but they're on the screen there for those who need it. We'll put the notes in the show notes as well. But Fen, obviously your phone number, email, the Floki website's there, and your LinkedIn profile as well. So this has been the Floki podcast. Where's my bladder scanner? And I'd like to thank you for watching, listening, or enjoying, hopefully, this particular podcast. So thank you very much. And thanks again, for your help, Fen.
Yeah, thank you, Nick. It's been a pleasure.